Okay. Yeah. Is my screen visible?
Yes, ma'am.
Okay. So, very soon we are having our patient case books released with all of us. It is a documentation record. In that, we have a few parameters to be, filled when the patient is there in our ambulance services till we shift the patient to the designated area. Okay. By this week we will be circulating that. After that you will be having many doubts once you start doing that records properly. So why I'm telling about that is in that we have patient and families rights and responsibilities. Got it? So it is very important as a healthcare staff or a paramedic for me to know what are patients right. Before I keep on reading that rights, I'll tell you why it is important with a example. Okay. Yes. You want me to directly read the points or you want me to quote example? You're all tired from listening class from 1 hour, right? Learner. What is this learner dangi? Learner dangi? So why it is important is when a patient, few many scenarios, you all will be handling many patients. One day you will be having 2 or 3 cases where you will be traveling far for receiving patients. Many times you don't know what are patients' rights. You will be thinking that this is my duty, I need to do this. Right? Patient also during treatment will have few rights, will have rights to refuse treatment or many rights. So you should know and respect them with the dignity. You should treat your patients with dignity and respect, and also protect the patient and patient's family rights. Got it? Here I just wanted to tell you about few rights of patient. Is my screen visible, right, Rajita? Yes, ma'am, it is visible. Yes. Patient and family rights for ambulance services. First one is right to dignity and respect. Every patient and their family have the right to be treated with dignity and respect. See, this is not, first of all, this is not a free service what we provide, right? Patients are paying us for the services what we provide. Ultimately, they'll be expecting dignity and to treat them with respect. Although I may be having so many tensions, right? I cannot show that frustration on the patient, right? Yes, you need to come. We will do this. You should sit. This type of language to be avoided, right? Yes or no? You all accept with that? Then you will be telling me that no, madam, I am having many patients, but then this patient is irritating me. That is why I responded in this way. No, how much our patient is irritating. Also, sometimes patients will be do this, do that. What are you doing? They will be having many questions. But then I should not show the reaction. I should not react immediately on patient. Right? This is one right to treat the patient with dignity and respect. Ambulance personals, that means either you, me, or your supervisors or your pilots, should maintain a compassionate and understanding attitude towards patient and their family members. You also, whenever you treat the patients, always greet. Communication is very important. As I always keep on insisting, your formal way of communication will change the patient or attendant's way of thinking, right? Yeah, we are in a high standard ambulance services where the staff will interact with us very professionally. They are very professional in doing things. As we carry our brand, we are our brand ambassadors for our Red Health. Okay, wherever you go and represent Red Ambulance. So by seeing you or by seeing the way you groom, by seeing the way you communicate with patient, all this plays a very important, and this plays a very vital role in promoting our brand in a positive way. Got it? And second thing is right to privacy. Okay, patient and their families have the right to privacy during the provision of ambulance services. That means you will be having a screen, right? Whenever you are transporting the patient, make sure patient is covered completely with the blanket provided. You cannot transport the patient with improper dress, or if patient is not having a proper dress, where it is it is a discomfort scenario where to see some person, you should not do that. You should completely have a respect on patient's privacy. If you're trying to transport all our structures, or this will be having, we have the blankets, right? We have a blanket in our ambulances.
Yes, ma'am.
Try to cover it. Also, if there is a screening when you are doing a procedure, try to screen. It is also important. It also helps as a it also helps in creating confidentiality and patient's privacy. Also, not only in ambulance, any healthcare services you do, confidentiality of patient information must be maintained. You should not discuss about patients with with other members in a in a story manner. For example, I'm telling you. Then you will maybe asking that what is confidential, ma'am? Like patient is having so and so problem. I'm making the patient transport to nearby hospitals. But what is confidentiality? One example I'll be giving you. There is an attempt of suicide happened somewhere. You got a call that to transport the patient. You should not create stories, cooking up stories, discussing unprofessional topics in between you. That also will comes under confidentiality. You should always maintain confidentiality. You should not talk about patients. What happened last time. Your primary motto will be to treat the patient. That's it. Main thing you should concentrate on that. Is that clear? Why you need to know all this is patient, as a patient, he or she came to our services to have proper treatment. To In order to in between that, you also will be having a few rights. Also, you need to understand what are exactly patient's right. That doesn't mean that patient came here, we can treat and then we can send, he's in our hands. No, patients are our customers. All of you accept that? Yes, if there are no patients to our ambulances, you and me will not be working here, right? So that courtesy you need to have among the patients. Whenever you go, however the day is very hectic, do not try to show your unprofessionalism towards the patient. Yes, you are wearing our uniform, you are representing our organization name. Always try to be a professional. Okay, the way you communicate, the way you appear to others, all this matters a lot when you are in workplace. Okay, and then informed consent, right to informed consent. We have a consent page in the book what we are going to release in this coming weeks. I'll be telling you about that consent also. Consent means any procedure you do for the patient in during your shifting procedure. It is always important to inform the patient and family members about whatever you are doing. If it is a simple IV cannulation, what you do in your ambulance, you tell that patient and then only try to do that. It is an emergency situation, I'm trying to do. No, arrange everything, inform and then do. Anything you do to your patient needs informed consent. That doesn't mean that during IV cannulation documentation is required. I'm doing IV cannulation, ask patient attendants to sign. No, try to inform verbally. But then there are two types of consent. One is written consent, where we have a consent form is there, like in our book, saying that we have few things like before shifting the patient to hospital, there might be chances of some accidents, or there might be chances of delay in shifting the patient to transportation. All these things to be informed and obtain consent, and then only you will be transporting the patient, right? Informed consent must be obtained before any medical procedure or interventions are initiated in ambulance services. Why informed consent is important is, if you're doing for example, we will not do any types of procedures in ambulances, but In some cases, if patient needs ventilation immediately, if you have some doctor or competent enough person who is there to ventilate to make the patient survive, you're trying to do intubation to patient, that you need to inform. Any procedures you're trying to do for the patient in ambulance services, you need to inform, obtain consent, and then only you will be going forward. Clear? And then next thing is right to timely response. Patients and their families have the right to timely response from ambulance services during emergencies. Delays should be minimized. We are not telling that delays should be avoided, right? Delays can happen because of many scenarios, like while reaching, you might be not having proper roads, or you might be not be having heavy rains, full of clogging of water, and then traffic. All these things to be minimized. Timely response for ambulance services is also needed, and communication regarding expected arrival time should be provided. Okay, time. If there is any delay in reaching the patient, if there is any delay, it is our responsibility to inform the patient that we are supposed to come at 3 o'clock, but then because of these scenarios we are running late, at least by 15 minutes or 20 minutes. Anything, you please try to inform. Also, what is my responsibility in protecting staff's rights? As I told, we should respect for dignity and privacy, informed consent. All these all my responsibility plays to protect them. How? By knowing all these rights, I will be acting thoroughly, right? If I know that patient is having right to refuse, right? Usually this in scenarios like ambulances will not happen, right? For example, right to refuse means, again I'll come to intubation. You're trying to intubate the patient attendant tells no, right now I don't want intubation. After going to hospital, their doctors will be deciding whether to intubate the patient or not. Then you should stop that procedure. Got it? Wait, let me call one name. It is like telling story only. You guys are...
Yes, ma'am. Yes.
Yes, Rehbar. Only you will be answering, Rehbar. Shijo, I will leave clinical supervisors. Rehbar, Rajita will be answering. That's it.
Everyone can answer, ma'am.
Yes, ma'am. Noting. कौन answer कर रहा है, note कर रहा है इधर.
Please, Shijo, if supervisors are helping us, that who is responding, we can actually recognize them, right?
Reward and recognition.
Reward and recognition, we can give that they're active listeners. Some kind of recognition they need. Every time.
Excuse me, ma'am, please. We can. अबे चुप हो जा.
Shijo can doing the recognition for myself.
Okay. You are nominating your name myself. So that is needed. Those who are answering properly should get something, right? So if I'm joining in class, sitting like this, passing my time, that doesn't give any value addition to your knowledge as well. And then next slide, communication. What is this?
Communication and documentation.
Your responsibility. Communication, I'm talking about staff's responsibility. Communication and documentation is important. As I told, documentation plays a vital role. That if you are performing any procedure, or if you gave any care to the patient in ambulance without documentation, it is like work without documentation is work not done, it is said. Okay, that is why documentation helps in continuity of care, also helps in any legal issues. If you are having proper documentation, we can also save ourselves. Accurate and timely documentation of patient's interaction, care provided, and any refusals of treatment is essential. You're trying to do something to the patient to save the patient's life. For example, you're trying to do CPR for the patient, but patient attendants are telling not to perform any CPR. You need to obtain consent, right? You all agree with me? Patient is not having carotid pulse, patient is unresponsible, but then you started doing CPR. You informed to the patient saying that patient is having cardiac arrest, you're doing CPR, but patient attendants tell refused that not to do CPR. That need to be documented, right?
Yes, ma'am.
Okay, good.
Yes, ma'am.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Ma'am, there are three major steps. Like when we are found a patient in pre-hospital scenario.
Sorry, sorry. One, I'm not getting. I'm not getting. Sorry.
Ma'am, the patient we are getting in pre-hospital scenario at the scene. What is the condition of the patient? That should be communicated advisely. And after transporting the patient to the ambulance and after shifting to the patient into the hospital, these three are the major steps which should be discussed with the attendants clearly.
Okay, you're telling that
About communication, ma'am.
about communication, right? Anything keeping updated about attenders, like when you're shifting the patient from ambulance to hospital, after reaching the hospital, it is important to always communicate with the patient attenders as well, right? That is what you're trying to tell, Rahbar?
Yes, ma'am. Yes.
Yeah,
And about the condition of the patient. The patient
about the condition of patient during transportation. About the condition of patient during transportation. Once you shift the patient to hospital, you may not give update that patient is very good now. No, this kind of updates after shifting to hospital you should not give.
Yes, ma'am.
Okay.
Ma'am. हेलो
हाँ सूर्यवन.
मैम इसमें एक चीज और होना चाहिए कि एक विटनेस भी होना चाहिए. जैसे मान लीजिए सीपीआर देने के लिए मना कर रहा है या इंटूबेशन के लिए या ऑक्सीजन लगाने के लिए, तो ये लोग किसी को सुपरवाइजर को या मैनेजर को लुक में लेकर के बात करें कि हाँ ये सीन है, ऐसा मना किया जा रहा है, ताकि विटनेस हो. हॉस्पिटल में क्वेरी आए कि आपके पैरामेडिक ने ये काम नहीं किया, तो हम लोग कह सकें कि हाँ ये रियल है, पेशेंट ने मना किया था. अभी एक कंसर्न हमारे यहाँ आया था मैम, डिस्टेंस बहुत शॉर्ट थी, उसने ऑक्सीजन लगाने के लिए बोला, अटेंडेंट ने बोला नहीं कोई जरूरत नहीं, आप जल्दी से शिफ्ट करो. पैरामेडिक ने शिफ्ट कर दिया, वहाँ हॉस्पिटल ने पैरामेडिक की भी वाट लगाई, बाद में that is only documentation is important.
Anything patient or patient attenders refuse. See, patient is having less saturation, 88 only. Then you're trying to connect oxygen masks to the patient. Patient is telling, no, I don't want. After going to hospital only, I will go for oxygenation. Then ask them to document. Then show who is the person who is shouting you. You're telling that after shifting to hospital, doctors or staff are shouting on us. Why? Because.
Hello.
Can you please mute yourself?
Hello.
Yeah. So you can show this as a proof saying that patient and this.
Hello.
Please on mute. Dilip, can you mute yourself?
Good evening, ma'am. Hello.
Yeah. So patient you can show that as an evidence that patient refused. That is why documentation plays an important role. Yes, Dilip, talk to me.
Yes, ma'am.
Yeah. Please tell.
मैम इधर मैं रायपुर एनएच में मैं हॉस्पिटल में हूँ ना अभी. पैरामेडिक दिल्ली यहाँ से अभी एक केस हुआ था मेरे साथ 1 वीक पहले की बात है. कर्मा हॉस्पिटल से पिकअप था मैम.
ठीक है
जी. पिकअप करने गया था मैम. वहाँ पर अभी जो सूरभन सर ने बोला ना ऑक्सीजन वाला, यही जो सिस्टम मेरे साथ हुआ था. पेशेंट 10 लीटर ऑक्सीजन पे था फेस मास्क पर, और डॉक्टर से जब मैंने हैंड ओवर लेने के लिए बात की डॉक्टर साहब से, कर्मा हॉस्पिटल जो डॉक्टर थे, उन्होंने डायरेक्ट मेरे से झूठ बोल दिया कि 2 लीटर ऑक्सीजन पे पेशेंट है. और रिलेटिव जो था उसने भी मना किया था मेरे से कि ऑक्सीजन मत लगाओ.
Relatives told not to administer oxygen for the patient, right?
Yes, ma'am.
Relatives don't want, but patients need oxygen.
Yes, ma'am.
Okay. In that case, what you will be doing? Tell me. That is what I'm trying to tell. If patient is refusing any of your treatment, patient is not willing to go for oxygenation, document that patient is not willing for oxygenation. There is a refusal form in our coming books. Ask them to sign on it.
Okay, ma'am.
You're trying to save patient because patient is having hypoxia with the saturation of 88%. Example.
Ma'am, 74% oxygen level is correct.
Yeah. That
situation. Yes.
Ma'am, if the consent form is not available, we need to write the A4 sheet and we can need to take the signature.
Definitely we can go for a written refusal form, na ma'am.
Yes, but right now, like we are having a nice books, patient case books, which are going to which are going to be implemented in past
PCR form, ma'am.
Yes.
Care form.
Yes. In that we have consent and refusal forms as well, right? Okay, Dilip, your question is very good. That you had.
We have sincere form. If anything like that, you can take a consent from PCR form and get a sign from patient attender.
Yes, Shiju.
I have one question.
Yes, Dharmesh.
If item is call given to the
Sorry.
aggregator, hospital manager will give call to
Okay.
aggregator. So our ambulance is not available and call given to the aggregator.
Okay.
So at a time, the SIMS hospital says that you should take consent. वो बोलते हैं कि हम रेड को जानते हैं, हम किसी और को नहीं जानते. तो उस समय consent किसे लेनी चाहिए?
Consent, way to obtain consent is what your question is, right?
Yes. किसे लेनी चाहिए? Who will take consent? It is aggregator.
इसमें अपना पैरामेडिक है, 10+ का है कि एग्रीगेटर का पैरामेडिक है, ये एश्योर करिए पहले.
नहीं, एक्चुअली हमारा पैरामेडिक नहीं है, एग्रीगेटर का ही है. लेकिन यहाँ पे कल एक एंटी राइज हुई है ऑडिट में. वो बोल रहे हैं कि अगर हम रेट को जानते हैं, हमने आपको कॉल दिया है, हमारा पेशेंट आपके थ्रू किसी और के गाड़ी में एम्बुलेंस में जा रहा है.
Okay.
लेकिन उसका रिकॉर्ड आपके पास कहाँ पे है? दैट इज द थिंग. आपने कंसर्न लिया उसका. सो उसके रिगार्डिंग मुझे डॉक्टर से भी बात करनी है.
But ideally, the consent, when the patient or attenders are refusing for the consent, our paramedics will obtain consent in our PCR forms till today. But we are having a new forms of books which will be implemented within coming few days. Then in that we have refusal consent also. They will be obtaining consent. Our paramedics who are going to shift the patient will obtain consent in that if patient or patient attenders are refusing any of treatment. Dharmesh?
Okay. My question is different. Anyway, we will talk to Tosif sir because ये एंटी राइज हुई थी.
Yeah. Dharmesh, just try to give me your number. I'll just try to get back to you on the same after this session. You try to type your number in chat box. Okay. I'll immediately call you after this session.
जो कॉल था लामा डामा या इस तरह के कॉल नहीं था जो एग्रीगेटर को दिया गया. मोस्टली होता है लामा और डामा कॉल ही एग्रीगेटर को हम देते हैं, बाकी हम डेडिकेटेड एम्बुलेंस से कराते हैं. ये भी आप पहले चेक करें.
और नहीं, ये तो है, लेकिन यहाँ पे बात ही कुछ अलग है. एक्चुअली मैं क्या बताऊँ अभी. ये लोग ऐसा बोलते हैं कि हम लोग रेट को जानते हैं. ठीक है, हम
I'll get back to you, Dharmesh and Shilvan.
एक्चुअली धर्मेश जी, एक्चुअली जब ऐसा सिनेरियो हमारे साथ भी हुआ है जब मैं कानपुर रेजेंसी में था.
ओके.
तो हम एग्रीगेटर के थ्रू जब काम करते थे तो जो भी लामा पेशेंट जाता था उसका कंसल्ट हम लेते थे.
ओके.
कंसल्ट फॉर्म हम भरवाते थे, चाहे वो हमारी एम्बुलेंस से लामा पेशेंट जाए न जाए, लेकिन हम कंसल्ट उस समय लेते थे एग्रीगेटर के.
धर्मेश जी का क्वेश्चन अलग है. आप लोग अजब क्वेश्चन पे क्यों सब डिस्कस कर रहे हैं? उनका क्वेश्चन सुनो, वो कहना क्या चाह रहे हैं. वो कंसेंट के ऊपर बात
कहना यही है.
See, let us not, talk here. You have some issues, right? With the consent and with consent forms. You had.
Hello, ma'am.
Yeah, that.
Sorry, I have a patient. I will get back to you in the meeting.
Sure. I'll call you after this session. Okay. Any such questions, any challenges in facing that questions, always try to reach out that immediately. Okay. Just now Dharmesh came with one issue and then Jubair is telling some other issues. Here, as a consent plays as a evidence, right? That patient refused treatment. I'm talking about a different scenario, and your concerns are on different thing. So if you want to discuss a certain things, what you have, what you are facing daily, you can always take your call and call us, so that we will sit together, make a decision, and give solution for you. Okay, Jubair?
Yes, ma'am. Actually, in the meantime, we are discussing the topics. It is a disturbance of everyone who is joining here. So we will discuss in privately, and is the common thing of the clinical instructor also is there. So we need to discuss the clinical instructions later.
Understand. I'll try to streamline this process in that way only, Rajita. Okay, Jubair? If you have any doubts, you have my number, you have my team members who are there in Hyderabad, so you can always call us if you're having some issues. Let us not, debate or argue in this session. Okay? Hello? Everyone became silent?
Yes, ma'am. It is okay.
Yes, ma'am. Yes.
Yeah. Thank you, Suryaban.
ये लेक्चर हो रहा है, थोड़ा हिंदी में हो जाए तो सबको समझ में आ जाए।
Hindi?
हमें तो कुछ हाँ जी हो जाए तो बहुत बढ़िया।
I'll be telling you, Ravinder. All this, whatever.
ये मेरी
मैं भी कहने वाला था
मैम ऐसे इसमें जो ये 45 बंदे ना, ऐसे में कम से कम 20% बंदे ऐसे होंगे जो इंग्लिश टू इंग्लिश नहीं समझ पा रहे। कुछ हिंदी, अगर कल एग्जाम देना है तो हिंदी में समझना होगा। अगर ये कि सर के ऊपर से ये निकालना और बस स्क्रीन पे सबको शो होना है तो एक अलग बात है। हम भी स्क्रीन पर शो होते रहेंगे और जो कुछ समझ में आ रहा है ठीक है, नहीं आएगा तो कोई बात नहीं है। देखो मैं क्लियर बात बोल रहा हूँ, ये नहीं है कि जो झूठ बोल रहा है, जो छुप रहा है अपनी वीकनेस छुपा रहा है, तो एक अलग बात है।
Let us not end up with this arguments. Someone, hold on. Clinical supervisors, please take control on this.
Yes, ma'am.
I request clinical supervisors to take control on this.
Yes, sure, ma'am. Ma'am, I requested you please mix English and Hindi, ma'am.
Got it. This Hindi is not a extreme level of Hindi where people will not understand, right? At least here we have completed basic thing. Basic English you all can understand.
Yes, sir.
Right?
Yes.
Whenever I'm asking you questions, you try to tell in Hindi only. Preparing questionnaires in Hindi, it is not possible. Questionnaires, whatever pre and post assessments we are conducting, that will be there in English only. Okay.
Sure, ma'am. Sure.
All our policies and protocols.
Any doubt? Sorry, ma'am. Any doubt in Delhi NCR area? Please contact me. ठीक है, अभी जो क्लास चलने दो, क्लास के बीच में इतना क्वेश्चन देके डिस्टर्ब नहीं करना, क्योंकि क्लास का टाइम लंबा हो जाएगा और मैम का टॉपिक भी पेंडिंग बढ़ जाएगा। इसलिए आप जो भी डाउट है आप क्लिनिकल सुपरवाइजर को इन्वॉल्व करो, वो बाद में क्लास के बाद में कोई भी डाउट होगे, ठीक है? Please.
Yes, let us understand one thing. All our protocols, everything are formulated in English only. You don't have a policies where it is set in Hindi, right? So basic English we are trying to tell. All your clinical supervisors are there to support you. If you are not understanding this, you are having any doubts, please do reach out to clinical supervisors. We and clinical supervisors will have a discussion and then wind up this session. Okay?
Okay, ma'am.
Let us not come into argument. Please, that is what punctuality and discipline is also very important when you guys are attending for some sessions. Do understand that, okay?
Yes, ma'am.
Okay.
Okay, ma'am.
So I'll continue this topic. When we join for other session, post test also I'm not going to share it right now. Okay. Let us wind up this topic. I'll have a discussion with your clinical supervisors, and I'll have a different meeting after this call with your clinical supervisors and get back to you in other session. Okay?
Okay, ma'am.
But how much people they can able to, ma'am, my small request is, how many members they are able to understand the English to English? We have to know first then, ma'am. Then only we can able to tell everyone. It is important to we are discussing the classes also, and same thing they can able to understand. They didn't understand what is the mean to tell the classes.
Yeah. I'll just have a discussion with your supervisors and get back to you. Shijo, Sangeeta, and other supervisors, I'll be just scheduling 5 minutes of quick call with you all so that we'll discuss about these concerns. Okay?
Yeah.
Thank you.
ma'am.
हेलो सर।
हेलो
Yes, बोलिए।
सर खत्म हो गई क्लास, जा सकते हैं क्या?
हेलो शिजो सही है।
हाय, 2 मिनट वेट कर देना, मैम ने आउट स्विच हो गया, अभी एक बार चेक कर रहा हूँ।
Tijo,